close enough contact. Now, if you're living in the same house together, obviously you're going to be sharing the same surfaces. So ideally, if, I don't know how many bathrooms there are, but trying to limit the amount of people that are using the same bathroom, washing all surfaces. If anyone has any fevers, cough, or any shortness of breath, to definitely make sure that they are tested and that they are isolating themselves from everybody else, so that everybody else doesn't get sick. So just think of this in terms of a little bit more contagious flu. If you guys are all sharing the same surfaces in the kitchen, bathroom, bedrooms, that you should be cleaning after yourself, washing your hands often, and I think that's about as good as you can do. Everybody has a unique situation.
I also think that it's important for whatever group you've been quarantined with to stay within that group and try not to expose yourself to any additional folks.
Right.
Might be a good tip.
Absolutely.
Okay, if you guys think of any other questions, please keep, putting them in there. And I'm going to switch over to the spreadsheet now from some of the other questions that we had gathered. So the next question is, are men more affected by this than women?
So statistically, yes, it's only 1 or 2%. So I think ultimately that doesn't matter. The 1 or 2% can easily be explained by whether or not they're being tested more or have come into contact with this more. So it's definitely not enough to where I would say, if I'm a man, I am more worried, or if I'm a woman, I should be less worried. It's pretty much the same.
Okay. Are people contagious before they have symptoms?
Yes. So I'll kind of explain the difference between influenza and this new coronavirus for a brief second, and then we'll kind of get into that answer. Influenza, so anytime you have a virus, the transmission of the virus at one point in time is going to be extremely high during your course of illness. With flu, it's during super high fevers when you feel terrible. But with coronavirus, it's can be anywhere during that length of your illness. So this is where it becomes easily transmissible, because you are contagious before you have symptoms. Studies have shown that anywhere between 2 and 14 days after you being actually infected with the virus, you don't actually have symptoms. So you could have caught it 2 days ago, feel perfectly fine, and you're able to transmit this to other people you come into contact with without knowing that you are sick. That's why social isolation, washing your hands, covering your cough, all these good hygiene practices are extremely important.
Okay. Is this an airborne disease, and what does that mean?
Yeah, so this is a very hard question, or at least hard to understand if you're not in the medical field. So this is a basically spread by what we call respiratory droplets, which is where you cough and you have little droplets with the virus attached to it that can spread out into the air. So now you would think, okay, it's in the air, it is airborne. You're technically right, it is in the air, but the virus and all the particles will kind of sink down and rest on any surface there, and they won't stay in that air for very long. So we don't consider it airborne because the difference between airborne and like respiratory or droplet is that airborne can stay in the air for hours and hours and hours. An example of this would be measles, where if you have somebody with measles, they cough in a room, you could physically leave the room, come back 12 hours later, and someone can catch measles just by walking into that room and breathing the same air. This is not that contagious. So we consider just droplet precautions for any sort of contact. And what that means is a face mask, but it also means cleaning surfaces, wearing gloves in the hospital. So for everybody outside of the hospital, it's really just distance, 6 feet, cleaning surfaces, and washing your hands.
Okay, the next question is, I read somewhere that the virus can't survive in an alkaline environment. Should I be drinking more alkaline water?
Yeah, so that's kind of similar to the other question of should I drink hot water or cold water? Ultimately, I don't think it matters. Again, this is going into when you're drinking water or eating something that's going into your gastrointestinal tract, not your lungs. Since this disease lives in your lungs, it shouldn't really matter what you do from that standpoint.
Okay, thank you. And we have kind of the next questions are, all kind of go with each other. The first one is going to be, if I have COVID, how do I know when it's bad enough that I need to seek help?
Yeah, that's a great question because, again, to separate this from the flu, we have a proven treatment. So in the flu, you really want to be seen within the first 2 days so that you can have this treatment and have less severe outcomes and get better quicker. But with coronavirus or COVID-19, we don't have a treatment right now. There are things in the works, but what that means is that instead of seeking treatment immediately when you have symptoms, since there's not much we can do at this point, it's really deciding when you're sick enough to seek care. So right now, if you just have a cough and a fever, but you're doing okay, you really don't need to come in for treatment. Now, if you are short of breath, like I talked with earlier, if you're having problems walking to the refrigerator and back to the car and back upstairs, that might be a time that you should call either your primary care doctor's office, any sort of telemedicine service, or call your local ER to possibly be seen.
Okay, and the next one is, when can I actually get tested?
So right now, there are, at least in the Austin area, since we're all in Austin, I'll talk about Austin, there are no drive-through clinics where you can just drive up. Everywhere, as far as Seton, Baylor Scott and White, needs a consultation first with a practitioner. So it's either a telemedicine consult or it's seeing a primary care doctor and then referring you to the testing site. But there are lots of testing sites available. You just need to see a health professional before you can have that testing done.
Okay, and then this is a good one because there's a lot of sick people.
Can you hear me?
We can hear you.
Yeah, I just want to add in one little point is that the capacity for testing is ever evolving and changing as companies and other manufacturers catch up with creating tests and making them more accessible. So I think it is really important when you do develop symptoms to go to the Austin Travis County Health Department to look at and find out who is doing testing and when and where you could get that test done, because as people get caught up with acquiring the supplies and things like that, we may see more and more testing, potentially even more testing for those who are well. But I think that we're still a few weeks away from that. But I think the Austin Travis Health Department website is a really good resource for where you can get tested if you're just wanting to get tested for corona.
Yeah, and that's the same resource we use in the emergency department to look on all the up-to-date recommendations from our local public health guidelines. So you're going to a very trusted source, and that's the same one we're going to use to refer you to whichever testing site you need. Now, right now, all the testing's done by a nasal swab, which takes anywhere between 1 and 3 days to get back. Hopefully, in the near future, in the next week or two, we're going to have blood tests, other things that are only going to take 15 minutes to maybe an hour, 2 hours to find those results.
That's great. The next question, should I avoid the ER at all costs?
Of course not. So, if you think you have COVID-19, you've got fever, cough, shortness of breath, you aren't sick enough to need to go to the emergency department, or you're not short of breath, and you don't feel ill enough, sure, you definitely need to avoid any area where you could get other people sick or people could get you sick. But if you do feel like you need to seek emergency care because you're feeling so bad, you're so short of breath, you absolutely need to call the emergency department or your primary care doctor. I would always call ahead of time and let them know you're coming because like in RER, Physicians Premier ER, we basically guide you to a separate entrance and separate rooms that we've kind of specially decontaminated so that you're safe and we can keep everyone safe taking care of you. So it's always nice to call ahead. That way they know you're coming.
All right. If I get coronavirus, how do I know when I am no longer infectious?
So that's a great question. So kind of two answers to that. One, if you've never been tested and you're just kind of assuming that you have coronavirus because you've got a cough, you've got a fever, could be a little short of breath, you are basically know that you're over being contagious if you no longer have symptoms. So basically none of those symptoms, no fever for more than 3 days. You have to be like 3 days totally symptom free. And you have to be at least a week outside of the start of your illness. So basically from day one, it's got to be at least a week long of illness, and then it's got to be 3 days after all your symptoms have resolved, then you know you're no longer contagious. Now, if you have been tested and you've tested positive, then you actually need to have another test done after all of your symptoms have resolved. And the public health department will guide you with this, but essentially you'll have 2 swabs 24 hours apart, and if both are negative, you're no longer contagious.
Okay. If I think I have the infection and don't get tested, when can I go back to my normal daily life?
Yeah, so basically it's kind of where if you're not, you said that if you weren't tested, is that right?
Weren't tested, but you think you have it. When can you go back to your normal life?
Yeah, 3 days after all your symptoms are over, then you can go back to your daily life. Normally we say 24 hours for a typical virus after fever resolution without taking any fever reducing medication. But for this instance, it's going to be 3 days.
And how long does the virus last?
Usually 2 weeks, but that is kind of variable. But typically, it's going to be run its full course in about 2 weeks.
Okay, great.
It looks like we got a couple of questions in
the chat. Okay, let me pop back over there. If you want to read the next one, Dr. Kinter, while I get back over there.
Sure. If you're infected and symptomatic, is there any point to going to the doctor or ER other than to be tested and confirmed? Would you only go if you're struggling to breathe or have any other life-threatening complication?
So everybody has a unique situation. Like one of the people that posted in the chat, they live in a 6-bedroom house with 12 people. I mean, I would say those people need to be checked instead of just self-quarantining, because it really matters on whether or not they're quarantining for 1 to 3 days or whether or not they're quarantining for 14 days. So while testing is available, I think living with an elderly person, being a healthcare worker, living with a lot of people in the same house, those all put you at risk for possibly getting a lot of other people sick. So I would say testing, even though you're not short of breath at that point in time, is probably reasonable. And then, of course, if you're so short of breath that you're having issues and you think you might need to be seen in the emergency department or hospitalized, then you definitely need to seek your ER at that point.
So what if somebody does get coronavirus, what is their immunity for catching it again? Or could they potentially get it a second time? Do we know that there's yet?
So there's only been a couple of cases where somebody has been reinfected. So of the hundreds of thousands of people that have been infected with coronavirus, there's only been a few that have been reinfected. Now, other coronaviruses, basically, long story short, it's unknown at this time. There have been other coronaviruses that you can catch multiple times and you don't necessarily have immunity to one if you've had it before. So the jury is still kind of out on that one. I think we'll definitely know within the next few months whether more people are being reinfected, but there have been a couple of cases of reinfection.
So one of our questions was kind of talking about, who's been affected in the Austin area. And so on the Austin public health department, it actually has a nice dashboard of the amount of cases that we have in our area. So confirmed cases in Austin Travis County are 137. Of those 137 patients, there have been 0 deaths related, but it also breaks out the age groups of who is infected. And the age group from 20 to 39 has the highest number of COVID cases, with 41 people have, you know, in that age group. So, you know, it's really important to know that the young people are getting this and possibly spreading it around to others in that age group as well.
Yeah,
So
if
I
you
think
look
it's
at that breakdown, I think when I looked today, it's roughly around 70% of those infected in Travis County have been under the age of 40. So it can happen to anyone. So you definitely need to take precautions.
I think, so we're going to switch back over to the spreadsheet here. Dr. Kinter, how do outbreaks normally end?
So in a pandemic like this, typically what's going to happen is enough people are going to get it to where there's something called herd immunity, which is essentially where you've built up antibodies in your system to fight the virus by recently being infected with the virus. It's essentially why we give vaccines. You're trying to build up some sort of an immune response so you can fight off this virus and it doesn't give you a severe infection. So basically what happens is enough people in the population have either gotten some form of the virus that leads their immune system to be able to fight it off, to where when it does spread, it doesn't just kind of burn through the whole population. It can have little clusters that end up dying out.
Mm-hmm. Okay, and what is the best way to preserve my health during this outbreak?
So again, you know, currently it's social isolation, so we don't spread this when we don't have symptoms. It's good hand hygiene, washing your hands, hand sanitizer, cleaning surfaces that are high use. But it's also just doing normal healthy habits, you know, eating good food, getting exercise. All that stuff is a little bit harder when you're kind of self-isolating and staying at home, but there's always things you can do to kind of keep yourself active and healthy, even though you're staying at home mostly.
So this is a question for me. A lot of people in my neighborhood are out biking and walking the trails. What are your recommendations for outdoor activities? I've also seen posts about, you know, people congregating at pools or Barton Springs or things like that.
Yeah, I think any congregating is a bad idea. I think, you know, I've got 2 kids. I've got a 4 and an 8-year-old, and we go out on bike rides together and go for walks. But you should basically stay in your little social network that you have. I mean, there's 4 of us, so we stay in a little 4-person group, and we go do these activities, trying to avoid other people. And, you know, we definitely don't go to the park and play at the park because, you know, you could easily contaminate things and leave the virus on other surface areas. But I think getting out, getting some sunshine, as long as you're not with a huge group or staying with a big group of people and congregating is fine.
Does anybody else have any questions? I think we've gone through all of the ones that we've collected, and it looks like we've got them from the Q&A. Does anybody else have any other questions at this time?
So I'll ask another one while we're waiting for something to come back in, is that we have, what are the biggest symptoms that we're seeing? Fever, I know that we've kind of talked about it, but I know that there's kind of been some other symptoms coming through, but what are the major symptoms that you see, that we are seeing with COVID?
Mainly fever and cough. Some people can have like a little bit of diarrhea, stomach cramps, sore throat, but mostly it's going to be cough. You know, people need to also realize that there are other viruses that they can get. You can still get strep throat. You can still get pneumonia from other things. Ultimately, most of these things kind of end up going away on their own, but it's just knowing when to seek care, and at this point in time, it's seeking care once you get short of breath, or if you're concerned that you could be giving it to somebody that's at very high risk if they do get COVID-19.
Yeah, we had another question pop up here. It says, I'm quite certain I am healing from it. Age 39. I live right on the Travis-Burnett County line. I went to Burnett County, Baylor, Scott, and White, knowing there was drive-through testing. I was refused a test because my coworker's roommate testing positive wasn't close enough, and there weren't enough tests, but they wanted to immediately put me in the ER because of my breathing or lack of. So how many cases do you feel there really are?
That's a great question. You know, I personally hope there are a lot of people that have already had this or currently have it and have very minor symptoms, because again, that's going to get our herd immunity up. You know, there's really no good answer right now. If you look at the way different countries are testing versus the United States, you know, a lot of other countries test everybody, so they're going to have high numbers. But if you don't test everybody, you don't really know who has it. So the big question is, you know, whether or not you should just be testing everybody. At this point in time, we don't have the capacity to test everybody. I think there are many more cases out there that we're just not aware of, because people are either just having such minor symptoms or they're not feeling like they need to go to the ER or anything to be tested.
And I think it's important to note that, you know, right now tests are kind of being saved for those who are really, really sick. And that's just to make sure that if these people are really, really sick, that we're treating the right thing. Is that correct, Dr. Kenter?
Yeah, you know, if you're really, really sick, we want to know how we treat it. And if you do have COVID-19, we know that antibiotics don't work against it. So essentially, if you're really, really sick and you need to be hospitalized, we need to know whether or not our antibiotics are going to work against this. So saving those resources of testing for the very sick people so that we can get them better is kind of our priority right now.
Awesome. All right, we have some other great questions coming in. This is a good one. I'm sure everybody is feeling that oak pollen that is in the air right now. So it says, my allergies are really bad and cedar fever can feel like a virus. How do I tell the difference?
So that is a good question. I can see the pollen outside dropping already, so I'm sure lots of people are suffering from their allergies. I think the best answer is going to be one, you know, whether or not your symptoms are getting worse or whether or not they are the same of what you experienced every year. Most people that get cedar fever or have really bad allergies kind of know what they're dealing with. You shouldn't be experiencing any shortness of breath. I wouldn't think most people, you know, unless you have this virus, should have high temperatures, you know, 101, 102, 103 temperature. You're likely dealing with more of this COVID-19 than you are with just having bad allergies. So, you know, itchy eyes, sneezing, scratchy throat, those kind of things are typically going to not be this virus. You're going to be more dealing with, you know, higher fevers, bad cough, shortness of breath. That's a great question. I think at the very beginning, it's hard to tell, but, you know, as the days go on, you can kind of tease it out.
Would it be wise to kind of test it out with your allergy medicine that you normally take and see if the symptoms improve?
Yeah, hopefully you should already be taking your allergy medication, but I would definitely use your nasal spray and your Zyrtec or whatever else you're taking to see if your symptoms get better.
All right. How helpful are things like vitamin D, oregano oil, etc., in terms of keeping you healthy from the virus? So maybe a little bit more of a holistic approach.
Yeah, it's a great question. I would say whatever you're currently taking, if you've been taking it for a while, you can continue taking it. There hasn't really been any evidence that any supplements help. There is some minor evidence that zinc can help with just common colds and viruses in general. But zinc can actually be toxic, so you definitely need to make sure you stay under any sort of recommended daily dose, which I think is 30 or 40 milligrams a day. So I would not add anything to what you're already doing. Again, everyone wants to try and keep themselves safe, but you're going to get the most bang for your buck if you're washing your hands really well, cleaning surfaces, and just doing kind of what you normally do with all of your typical supplements or other medications.
Alrighty, I think we have another one over here. Have we had any positive tests from any of the PPER patients that we have tested?
So I think pretty much everywhere at this point has had some positive results. Most of us work at the hospital as well, and there's multiple people per day that are testing positive. So I'd be surprised. I even know of doctors' offices that are, primary care doctors that are testing patients and they're coming up positive. So I think it would be hard pressed to find any location that treats patients currently without at least one positive test result. So you just got to be aware that it's out there and there's going to be results everywhere. But there are ERs, especially with Physicians Premier, take special precautions to make sure that if you are coming in for an emergency that is not COVID related, that you are safe. We have definite separations of our emergency department, separate entrances, separate areas that you're treated. So it's just kind of inevitable that this is going to be everywhere. You just got to make sure that wherever you're going is taking those necessary precautions to keep you safe.
Okay.
Dr. Hunter, do you want to talk about some of the other precautions that we've taken in RER, and if you go to other facilities, want to make sure that they're taking?
Yeah, so I think the biggest, from all the research that's been done from this virus overseas, the biggest way to keep everyone safe is, like I said, separate treatment areas in the emergency department. So like, for instance, if you show up at our Central Austin location, you're going to be directed towards a separate entrance so that people that do not have fever, cough, or shortness of breath are kind of in one track, and then people that do are in another track. And that's to just basically keep the patient separate for both their safety, but it's also letting us prepare to treat you appropriately if you do think you have COVID-19, because now you are in a separate area of the emergency department where our staff is able to give you a mask, is able to give you gloves, is able to take care of you to where we will keep you as safe as possible, as well as our staff safe. We also take extra precautions to where the paperwork is not handed back and forth, that the different x-ray machine that we're using compared to other, just basically keeping the entire treatment separate from each other, I think is the most important thing, and that's what we do at all of our sites.
Okay, I had one more question pop up. Do you believe the virus was here back in January? I know people who died suddenly from a virus.
It could have been. It could have been maybe late January, early January. It's really hard to say, just because there's so many people that are either very minor symptoms or just no symptoms at all that end up having this. I don't have a definitive answer for you. I think it's been around maybe a little bit longer than late March where we are now. But as far as early January, that's anybody's call. I think we'll know once we make it through this and look back and look at all the evidence. We'll kind of have a better indication of how things progressed.
All right, does anybody else have any questions? I think we covered it all. So thank you, Dr. Kinter, for taking time this morning to answer all of these questions. And if anybody has any other questions, they definitely can call up to the facility and reach out and ask at any time. That's what we're there for, is to help everyone get through this difficult time.
Yeah, definitely don't hesitate to give us a call if you have any questions. We've got a doctor and a nurse pretty much there 24/7, answering questions you have and kind of direct you into going to the right resources. And then if you have if you want to read anything, I would definitely stick with the Austin Public Health Department website for COVID-19. They do a great job at keeping all that information in one place and making it readable. All right. Well, thank you very much.
Awesome. Thanks, guys. So we're going to, I think, have this as a recording that we'll be able to share with the chamber members later. So
Great.
let us know if anybody needs anything. We're here for you.
All right, everybody, have a great day.
All right. Bye.
Thank you, everybody, for attending. Thank you for your, thank you.